Good day, everyone. My name is Shanmati Shanmugam. I'm going to present about Cri du Chat Syndrome. Here we start with who and when did it happen. A genetic by the name of Jerome Lejeune first identified this illness in 1963. Where and how was it found? In France, this illness was found. After examining chromosomes, he found a segment that was result of a random, non-heritable deletion of the short arm on chromosome 5. Cri du Chat, normally known as cat cry syndrome. Babies with this syndrome frequently wail in high-pitched manner that resemble a cat. Also known as chromosome 5 deletion syndrome and Lejeune syndrome. This is how they determine if the child has the disease. I had attached a YouTube link about the baby crying. Here I'm gonna explain how do people get it. A DNA package in 46 chromosomes contains the genes and pretty much instruction for making proteins. These proteins control everything from growth and the development to day-to-day function of cells. Each of the 46 chromosomes is actually made up of pair of chromosomes get each from the parents. So 23 pair and these chromosomes are shaped like X. In this shape like X chromosome got two short arm and centromere and long arm. These two short arms in French term called as small. Cri du Chat syndrome, a part of one of the short arm of chromosome 5 is missing. So, Cri du Chat syndrome, also known as 5p deletion syndrome. In the way of statistics, 80% to 85% of cases of Cri du Chat syndrome results in de novo deletion, which means it occurs without being inherited. 10% of cases of Cri du Chat syndrome deletion are inherited from parent with a balanced translocation, means a part of one chromosome which is replaced the part of another chromosome and it balanced so there is no genetic material gain or loss. The person not experienced with no adverse effect. Let me see what is balanced translocation actual mean. This is a female who have normal 23 chromosome and this is a man who got carrier type. If this female marry into this man, we can see the part of chromosome 5 switch place with the part of chromosome 11, but he remains normal because no genetic materials is gained or lost. But these two have a baby. The baby randomly have two copy of chromosome, one from mom and one from dad. Since mom and dad two copy of each chromosome, if the dad passed on translocated chromosome 5, but the normal chromosome 11, the translocated information from chromosome 5 will be lost. In this case, balanced translocation in father becomes unbalanced translocated in child because some genetic materials from 5 chromosome 5 lost and this baby have Cri du Chat syndrome. These are the symptoms if the baby have Cri du Chat syndrome. Extremely high pitch, cat-like cry, delayed development, it means slow to grow, microcephaly, small head size, hyperthyroidism, widely spaced eyes, low birth weight below average, and could be F hypotonia, weak muscle tones. These are the list of effects the baby might be have if the baby undergoing with Cri du Chat syndrome. Ventricular septal defect, intellectual disability, failure thrive, hypotonia, feeding problem, constipations, recurrent infections such as otitis media, respiratory infection, and UTI. These are the methods how doctor treat or diagnose the baby with Cri du Chat syndrome. Sometimes the doctor order to karyotyping to see whether the 5p got deletion or not. This is normal cell. This is 5p deletion chromosomes. If clinical suspicions but karyotype is negative, it will go under fluorescence in situ hydrovisions, which is known as FISH. Fluorescence label probe is complementary to 5p regions. The physical exam is the test that is most frequently performed because it can almost always reveal all the symptoms. Sometimes a missing chromosome might be found through genetic testing such as karyotyping, FISH. This is a pedigree chart of Cri du Chat syndrome. It might look like this. I just zoom in the karyotype image for more explanations and clearness. This picture shows ideogram of the maternal CCRS. What can we actually do if the baby have Cri du Chat syndrome? The goal of the National Association for Rare Disease is educate those affected by this condition about what Cri du Chat is and how it affects them, increase knowledge of the illness and reassure others that they are not alone. And these are the citations I used to complete my presentation slides. Thank you so much.